How many of you all struggle with figuring out what teaching strategies you're going to use or how you're going to evaluate your students? Are you unsure about whether or not students are connecting the dots or if they fully understand the concepts that we are trying to teach them? Well, if your answer is yes to either one of these questions, you're not alone. In fact, more than 70% of nurse educator colleagues that we speak with do voice a concern about whether or not their teaching strategies are really making a difference, whether or not the content is really landing in a way that allows students to truly apply and analyze these concepts to ensure that they are making safe patient care decisions. Welcome back, everybody, to Dr. Sellars Educate, where our mission is to support all nurse educator colleagues to achieve nurse educator excellence in the classroom, which in turn leads to student success and also to help you pass the CNE exam. 64%, that was the success rate in 2022. We know that here at Dr. Sellars Educate, 95 to 100% of colleagues that we support following the 7-week study plan are successful on the CNE on their first attempt. Okay, that's a really important component. We know that many colleagues spend 5 to 10 years sometimes getting ready for the CNE exam. Life happens, right? And so we have to pivot. We have to get back on track when we get distracted in order to achieve success. Well, in this snapshot, we're going to be talking about a muddy point that more than 50% of educators struggle with, and that is Kolb's experiential learning theory. We're breaking down this concept and really this framework throughout our summer series. We're going to focus on Kolb experiential learning theory as well as curriculum. Okay, and so when you think about these two important categories of concepts, it is a really important part of our curriculum and how we develop student success in our classroom, how we engage in the coaching and the facilitation of learning that we know is so important with our students. All right, so if you haven't already, go ahead and print out your study worksheet. And then what we're going to do is we're going to talk through what we're focusing on in this snapshot, which is looking at two different concepts. Okay, so we introduced in our last snapshot an overview of the four different learning styles. And in this snapshot, we're focusing on essentially the converging category of learning styles. And specifically with the learning theory, we're focusing on thinking, which is abstract conceptualization, active experimentation. Okay, so going back again to our title slide, thinking versus doing in learning. We know that there is a really important role for both, especially with our nurse educator students, nursing education students. So our ability to share these theories in the classroom, we want to be able to transition students into practice, really bridge that theory to practice gap that Patricia Benner talks about, so that students are able to apply and analyze and ultimately create, right? Where they are generating new knowledge, where they're developing those clinical judgment skills in order for them to make the best patient care decisions. Okay, so if you're not familiar with the Kolb's experiential learning theory, there's a couple of resources I want you to look at. Okay, so that's going to be page 35 in Dr. Caputi's CNE review book. That's the second edition. And then you're also going to take a look at Billings and Halstead Teaching and Nursing. And there's a couple of pages that you can focus on. I want you to also print out your study worksheet if you haven't already. Okay, so those are some key these are some key resources you want to focus on as we dig deeper into the content. So on page 30 in Billings and Halstead, and we are still using the 6th edition. And the reason why is because when the exam writers from NLN did a workshop during the last summit, they talked about the fact that they have used primarily 2 resources, and they included the 6th edition for Billings and Halstead. Okay, the 7th edition was already in publication, but it wasn't released yet when they were writing the exam questions. And so that's why they used the 6th edition. However, if you have the 7th edition, we already have the crosswalk linked right here in our description. So you have that resource as well. The number one distractor when you're on your journey for CNE success is using too many resources. We only want you to use 2, and that is Dr. Caputi's 2nd edition CNE review book and Billings and Halstead, which you all already know that we consider that to be our Bible in nursing education. All right, and then since you already have your study worksheet, we're ready to jump into our content for this snapshot. And I would say if this information is sounding a little foreign to you, I want you to write down what your muddy point is. Okay, so what is stimulating frustration or questions that you have related to this content? So let's take a look at our thought-provoking question. All right, so here we go. The nurse educator notices that one of their students excels in hands-on activities, but struggles with theoretical exams. To better support this student's learning style, which Kolb's learning style should the educator consider, and what strategy should they use or should she use? A is diverging, incorporates more visual aids and storytelling in the lectures. B is accommodating, to provide more hands-on activities and practical experiences. Or C, assimilating, to increase the focus on detailed theoretical content and logical reasoning. All right, so let's go back to our two concepts that we want to focus on, and really a strategy. So what are these strategies that you want to focus on when you think about the questions on the C&E exam? All right, so step number one is, what is this question really asking me? Okay, so take a look again at this question. It gives you a scenario, and in the STEM, that's very common. You're going to see what will be a scenario in some of the questions. Not all the questions will have a scenario. So with this specific one, it's telling you a little bit about what the nurse educator has observed with this student, right? That they excel in hands-on activities, but struggle with comprehending theory. And then the second consideration we want you to think about is, what is this question, or what is it that I know for sure? Okay, so number one, what is this question really asking me? And then number two, what is it that I know for sure related to this question? Okay, and then before we end our snapshot today, we will go back through this thought-provoking question and make sure that we have clarified any concepts that you may have a muddy point about. All right, so what else is it that you want to consider as you think about content that we'll be covering in this snapshot? Well, first of all, we are comparing the two. Okay, so this is AC versus AE. We'll continue to dig deep into these concepts over the next snapshots throughout the summer. But abstract conceptualization allows us to focus on class content, these key concepts that we want our students to fully comprehend and be able to apply in a way that is going to take them to the next step or transition into the next step very easily. Okay, so that's abstract conceptualization, where students are in the classroom oftentimes, but it could certainly be in the clinical setting. It could be in the skills lab, where students are really trying to put their arms around these concepts because they may not have grasped the complete practice component, which we're going to talk about that in the next snapshot. Okay, so that's abstract conceptualization. And then we have active experimentation. Now, this allows students, our learners, to engage in these hands-on experiences, just like the scenario and the thought-provoking question that we looked at. We know that several students are very excited about those hands-on experiences. But how many of us know sometimes they're not quite ready, right? They're not competent, or at least at that level where we can check them off on that skill in order for them to make safe practice decisions, right? So we have to reinforce, we have to coach, right? We have to remediate sometimes to ensure that students are fully comprehending these concepts in a way that will allow them to take safe patient care practices seriously and know exactly what to do in the clinical setting. All right, so what else is it that we know about active experimentation? Well, we know that it allows for students really to connect the dots. They learn by doing and experimenting with these concepts. So let's talk about an example. All right, so we have a student that shows up in the clinical setting for the very first time to insert a Foley. They're going to reflect on content that they've learned in the didactic setting and in the skills lab, and perhaps in the simulation lab as well. And then they are going to start to make sense of it based on what they see in front of them, based on the guidance that they are given by the clinical faculty, and then they're going to make a decision. Okay, so when we think about Kolb experiential learning theory specifically, we're focusing on AC, which is abstract conceptualization, And AE, which is active experimentation, we want students to be able to reflect and really pull from those concepts that they've learned about in the classroom. Okay, so that's abstract conceptualization. But now they have a chance in that clinical setting to actually practice it. So this is when they're going to engage in that active experimentation. Now, one other element as we go back to the actual model that I want to point out is that you can see that these students, the learning style in between the thinking and the doing are the convergers. What else do we know about Kolb experiential learning theory? Well, we enter this cycle of learning that he talks about when we have that concrete experience. Okay, so that is essential in Kolb's learning theory. What else does he say about this model? Well, we can enter and exit at different points. And because of that, we would expect that the learner has already had some type of interaction, right? Because they entered this learning theory by having that concrete example, right? They had a feeling. Feeling implies that it's a hands-on experience. And so because these students, this learning style converging actually is in between these different phases of the learning cycle, we would expect that this student is bringing into this phase of the learning process a previous experience, right? So maybe it's not the first time, because going back to the example that I shared, they have had hands-on experience in the skills lab or in the simulation lab, right? Before they get to that clinical experience of actually practicing that skill of Foley insertion on a real patient. So for that reason, we know that when we talk about a converger, they are pulling oftentimes from a prior experience. Okay, so that's something to consider. And what I would say is, if this is a muddy point for you, we hope to see you in our monthly boot camp, because that's when that's where we dig deeper into these concepts. All right, what is it else that you want to know? Well, looking at the different learning styles, there are 4 different learning styles. We have the diverger, the assimilator, the converger, and the accommodator. In our previous snapshot, we shared some examples of teaching strategies that are associated with each one. I like what Albert Einstein said. He put it very simply, which is learning by thinking versus learning by doing. Well, what we know now is that Kolb's experiential learning theory describes exactly that. There's a role for both, but with abstract conceptualization, we're learning by thinking. So we're thinking about, with that Foley example, what are the steps that I'm going to follow when I get to the clinical setting or the skills lab or even simulation to make sure I'm properly following sterile technique, to make sure I am clear about the landmarks, especially if it's a female patient, that I need to be mindful of when I'm inserting that Foley catheter, versus learning by doing. So I've had the experience and I'm reflecting on what went well, what didn't go so well, and then I'm making a decision. That's that active experimentation about what steps I'm going to use when I have that next hands-on experience. All right, and then next, when we consider these comparison of these 2 different learning phases associated with Kolb, is that 2 out of 5 learners, now this is pretty compelling, and of course the data varies depending on the research that you look at, but 2 out of 5 learners actually prefer theory and reflection in the learning process. And then we have 4 out of 5 learners that prefer those hands-on experiences. This is what helps 4 out of 5 of us really be able to connect the dots for it to be effective, for it to be meaningful, and it to be an experience that we can take into our next experience. And so that's that relevancy when we talk about students feeling like it's busy work. One example I like to use is the ATI quizzes and any of the ATI work, or even HESI work that we assign, right? So students often don't see the value in that additional work that they have to do. But we know that adaptive quizzing, we know that unfolding case studies, we know even with the simulation that students are able to do on a computer, all of that helps to advance students' clinical skills in a way that will prepare them to move through Kolb's experiential learning theory. So no, it's not necessarily that direct patient care practice that we're talking about that really generates that the learning theory cycles. But what we do know is that students are able to grasp those concepts using simulated experiences or using scenarios that will better help them think about what questions that they have to help bridge, again, that theory practice gap. So we don't want to start teaching clinical in the actual clinical settings. We start teaching clinical in the classroom setting. This is what Patricia Benner's call to action when she published Educating Nurses. I'm sure so many of you have that book on your bookshelf. If not, it's a great read after you pass the CNE exam. But that is one of her missions, and really, like I said, one of her calls to action. Abstract conceptualization is all about thinking. Active experimentation is actually about doing. So I have the skills, I have the knowledge that I need. I'm thinking about what next steps I want to take, but then there's action. So that's the doing, and then I try it. Active experimentation is exactly that. It's all about experimenting, right? So I'm thinking about what the steps are that I'm going to take, and that's abstract conceptualization. So AC, and then AE is I'm actually doing, and then the other component of AE is that, you know what? It may go well, it may not go so well, but I have prior experiences, and based on the feeling and the thinking and the doing, I am more likely to be successful as I process through all of these 4 phases of the learning cycle. Kolb's experiential learning theory also says we have not completed the learning process until we go through all 4 of the phases. Okay, so each of these 4 phases are essential for us to complete the learning cycle. I have that concrete experience. I'm engaging in that reflective practice, very similar to Tanner's clinical judgment model. I'm going to think about what went well, what didn't go so well, as I formulate as a converger what my next steps are going to be. That's the active experimentation where I'm doing. Okay, and then that accommodator is actually that final step where I've gathered all of the experiences that I've had from the previous phases, and now I'm ready to have another concrete experience. All right, and then next, as we wrap up with our final content for our time together in this snapshot, I want you to think about, what are these learning methods? What are these teaching strategies that I'm going to develop to help my students move through all 4 phases of the learning process? Students sometimes get stuck. When you take a look at the actual model, students can easily get stuck if they do not understand the concepts that we're talking about, going back to Foley. Well, if they skip a step as it relates to the sterile technique, then students may get frustrated, right? They may feel overwhelmed. So we have to help students move through the cycle, and we do that through facilitation of learning using the evidence-based practices, such as creating an inclusive environment where students feel like they trust us, creating that brave space where students can feel comfortable raising their hands to say, you know what, I have a question. That's still a muddy point for me. Can you go back? Or staying after class, or come into our office hours where they feel like they can ask us questions for understanding. When we look at Kolb's experiential learning theory, Tanner's clinical judgment model, Patricia Benner, novice to expert, they all really say the same thing. In order for learning to happen, for us to scaffold, even Bloom's taxonomy, for us to scaffold the learning with our students, they have to have the foundational knowledge in place. That starts in the classroom, and we have to be able to bridge that in a meaningful, relevant way so that students are able to apply the concepts that we teach. So that's what you want to think about. What ways am I engaging my students in abstract conceptualization, where they're having time to really process the content and the experiences that they've had? And then that active experimentation. How am I supporting students to plan for the next clinical experience they're going to have related to sterile technique or related to Foley insertion? All right, so that's that step, that critical step that you want to think about, that you want to take to best support our students. All right, so abstract conceptualization. The first element I want to focus on is embracing ideas actively. Okay, so that's a responsibility that we have. And how do we do that? So I want you to go ahead and write down just 2 ways that you have, let's just say in the past month, help students embrace these ideas that they may have, questions that may really trigger you to think about, okay, I thought we covered that learning objective, but maybe we didn't do such a good job. Okay, so write down 2 ways that you feel like you have actively engaged students in abstract conceptualization now that you know exactly what it means. All right, so go ahead and write that down. And then as you think about what you wrote down, these are some examples. So reflective thinking, such as our debriefing during our simulation, our reflection journals, students can do those after clinical experiences, and they can also reflect at the end of class. You know, reflection is not only exclusive to the clinical and skills lab or sim lab setting, we can also do that at the end of class. I know one colleague talks about a ticket to exit their class, and that would be a great opportunity for us to engage our students with the reflection activity. And then what else? You could engage in synthesizing information. That's another way when we think about how to engage our students in abstract conceptualization, when oftentimes they may not even think about the value of that, right? So we want to synthesize and make meaning of content with our students. That's how we can actively trigger students embracing these new ideas or to generate questions that they may have. So it does allow these students to put together these ideas in a way that is meaningful, right? They're experimenting with risk. Of course, we have to balance that because we're talking about patient care. And we want students to really process this feedback, right? So we want to give students a lot of feedback in this phase of learning in order for them to improve their clinical practice next time, or even more importantly, to connect those dots in a way that they are able to recognize mistakes that they made, or maybe it was an avoidance. So maybe they avoided an error when they went through the Foley insertion the first time. Okay, so those are some strategies that we can use to support abstract conceptualization and really students going through that phase of the learning process. Okay, so what else as we wrap up? And then active experimentation. So same thing, put in thoughts into practice. So write down 2 strategies that you've used to engage students in active experimentation. I know this one is easier than abstract conceptualization. All right, so I'm sure it won't take you long at all to write down 2 strategies that you've used to help engage students in this phase of the learning cycle. All right, so if you wrote down as an example, having these hands-on experiences in the skills lab, developing simulation scenarios with our students, even unfolding case studies in the classroom, role playing in the classroom, that's another really good one. But this allows us to turn those concepts that we've discussed into action. This allows students to truly learn through trial and error. Of course, we always want to mitigate risk with our patients, but those are some examples, and hopefully those matched some of the examples that you wrote down. And then for our thought-provoking question, if you chose B, accommodating, you are correct. So give yourself a round of applause. Remember that we want you to focus on and celebrate, absolutely, when you choose the correct answer. But most importantly, we want you to understand the rationale for the correct answer and the incorrect answer. Okay, so accommodating, it allows students to engage in those hands-on experiences, to have practical application and really to connect the dots. So if this was a muddy point for you, or you didn't choose the correct answer, use the resources we mentioned. That's Billings and Halstead, page 30 and 31. And then Dr. Caputi, you're going to find that content on page 35. Well, we hope that this snapshot has been helpful to help you bridge your theory practice gaps. And if you have any questions about the content here or any content on our YouTube channel or on our website, feel free to reach out, info@drsellarseducate.com. Until next time, we will see you in our next snapshot, and we hope you have a great one, everybody. Bye-bye.